we are going to be talking labor traps. These are the things that you wouldn't expect to be a trap when you're going through labor. After all, there's been this idea that labor is supposed to go a certain way. You see it in all the textbooks. They talk about the stages, they talk about everything else. I'm going to get into that. But first, I'm going to ask you a question. When your labor doesn't go the way that you think it's supposed to go, like there's something wrong, what's your first reaction? Is it to automatically do something to fix it? Because if it is, then you're going to want to pay attention. Because the truth is that your labor is going to unfold the way that it needs to. Because your baby is running the show, your body's running the show, and your body is actually really smart when it comes to contraction patterns, when it comes to dilation, when it comes to when it's actually time to give birth. So I've talked about the natural birth traps, and these are also things that are technically labor traps, but I've really nailed down 10 labor traps that you don't want to fall into. So this is a problem with a lot of care providers, is that they're going to tell you, guess what? Your labor's not progressing. We have to do something. Failure to progress. Failure to progress is a huge problem because then it leads to you getting an intervention that you didn't need, interfering with your physiological process, causing more pain for you, and possibly even a C-section. So if you want to know more about how the maternity care system basically derails natural birth, then you want to check out Rachel Reed's book. This one right here, Reclaiming Childbirth as a Rite of Passage. She goes into great detail telling you all about the physiological process and how when you look at practices for maternity care, it's not that. It's not facilitating the physiological process. And this is why I also say with my book, Your Empowered Birth, you want to have the right mindset. You want to have the right education. You want to have the right environment. You want to have the right facilitators, and you want to have the right support. If you don't have these optimized, then I invite you to get Your Empowered Birth, which currently is available on my website. You can go to empoweringmomsbirth.com/book. But today we're focusing on the labor traps, and I've got 10 of them. We're going to do the first 5 today. So, what is labor trap number 1? Cervical dilation. Yes, it's a natural birth trap and a labor trap, because once you get past the whole thing of you're not in labor yet and you're not dilating and you're not exactly going to be progressing, this is also a problem as a labor trap, because when your cervix is not dilating, the first step that they want to take is break your waters or get Pitocin running. Something needs to happen to get your cervix opening. How many times do you see that in the mom groups? I'm only dilated X centimeters and I need to dilate fast or else I'm going to get a C-section. How do I get labor to keep progressing? No. If your cervix isn't dilating, it means that you probably need to either change a position or get some rest and stop trying to do all the things to try to get things going. Labor will progress when it progresses. There's no problem with your cervix not dilating 1 centimeter per hour. But this is a labor trap, because oftentimes what you're being told is that if you're not dilating 1 centimeter per hour, then there's something wrong and they need to do things to you. I even got this, especially as a second-time mom. I was told that I needed to be dilating 1 centimeter per hour for labor to be effective. It's not true. It's a lie. Your cervix could be doing absolutely nothing, and your uterus could be contracting and building up that muscle, and all of a sudden you go from 0 to 10 and baby's out. So do not follow the idea that you need to dilate. First of all, if you never have a vaginal exam, you'll never know how much you were dilating and at what point you started to really progress. You'll never know. And that's a good thing, because if you never know, if you never have that doubt that you're only 1 centimeter or you're only 4 centimeters, you don't have that in your head, then what happens is that when your baby's born, it's just a surprise. It's like, oh, wow, labor actually was a lot faster than I thought it was going to be, rather than discourage you. So cervical dilation means absolutely nothing at every single level. Even if you are in transition, and they check your cervix and they say, you are only 6 centimeters. You are failing to progress. It's a lie. It's a lie. Because then on that next contraction could be a pushing contraction that causes your uterus to push down on the cervix and open you up that last few centimeters. Or if you have a cervical lip and they're like, you've got a cervical lip, we've got a problem. We got to get you in for a C-section because labor is arrested now. No, it's not. No, it's not. Maybe your next contraction that you have is going to help you push past that. But if you've been following what your doctors have been telling you, don't push until you're 10 centimeters dilated or whatever the mainstream childbirth education says, what's going to happen is that you're not going to follow the instincts of your body. So the bottom line is you want to follow the instincts of your body. That's labor trap number 1. Labor trap number 2, I've already kind of led into this, is your consistency of your contractions. So often you're told you need to be having longer, stronger, closer together contractions, that they have to be consistent. They have to consistently be strong. They have to consistently be like following a pattern. I have been a doula now for a number of years. I've been in the birth community for 10 years. I have had a physiological birth. I have witnessed that labor doesn't actually follow that pattern. The reason Pitocin was invented was to force people to follow that pattern. In fact, Friedman's curve, which the whole dilation and labor patterns is based off of, came from a study that was done in hospitals where the moms were all on Pitocin. So of course, if they weren't dilating 1 centimeter per hour on Pitocin, that's a problem, but that's a problem with the drug that they're using. That's not a problem with the bodies. It's a problem with the idea that you need to be as efficient as a machine. No, you do not. So if your pattern of labor is that maybe you have 1 contraction at 10 minutes and it's pretty intense, and then you have another one maybe 4 minutes from now and it's mild, and then you have another one and it's like back to 6 minutes, that doesn't mean that you're not progressing. I had a very irregular labor pattern, and even Rebecca had a very irregular labor pattern. In fact, Rebecca's labor pattern was so irregular that when I was looking on the app, because I was timing the contractions as her doula, I could tell that they were spacing out, and then they'd get closer together, and then they'd space out again, and then they'd get closer together. Because she had had 2 previous cesareans, my theory is that it was because her uterus was trying to make up for that. It was compensating for that uterine scarring to make sure that things were not too intense so that she could birth her baby. Your body is very smart, okay? So you need to recognize that your instincts will tell you to do certain things, getting into certain positions, or you're going to have one really strong surge that's going to push the baby down. Maybe you're going to have another contraction that's going to shift the baby into a different position. Your baby is working with your uterus, and then it's giving the feedback to your brain, which then releases the hormones for oxytocin to either make the contractions stronger or make them less. So if 1 contraction was too strong on your baby is signaling, hey, that one was too strong. We need to ease off. Or maybe your uterus is saying, hey, this one is a little bit too much for what we're dealing with. We've got a uterine scar. We need to compensate for that. Feeding back to your brain. You know what happens when you have Pitocin? There's no feedback to your brain. You know what happens when they break your waters? There's no more of that cushion with the amniotic sac for your baby to be protected from the surge of those contractions. So then that could cause distress. When you interfere with a physiological process, what you're doing is you are basically taking it and derailing your birth and saying, you know what? Now we're having a medicalized birth, because now we've introduced too many variables. We've introduced these problems that otherwise wouldn't be there if we didn't intervene in the first place. That is why there is that cascade of interventions. It's not just that one intervention sets them all off. It's depending on which intervention messed with the physiological process that needed to happen. So maybe breaking your waters doesn't do it, but maybe Pitocin does. Maybe it's the vaginal exam. Maybe it's the fact that you're on your back. Whatever it is that's interfering with your physiological process, and you won't know until you're going through labor and realizing that things are not working anymore, and that now your baby's in distress, or now you're having problems. You won't realize which intervention it was. This is why I say natural birth traps. Most of them are these interventions and routine maternity care practices that don't facilitate physiological birth. You want to know what will facilitate physiological birth? Reclaiming childbirth as a rite of passage. I know it's thick, but it is just a wealth of information, and it will help you so much. Labor trap number 3 on the list is the spacing of contractions. I already talked about this, but if you think that they have to get longer, stronger, and closer together, they don't. They don't. In fact, with Rebecca's labor, what happened is that as she hit transition, she started to space out those contractions, and she actually got a break. So with mine, with my transition, it's just like ramps up, and it's 2 minutes of really intense contraction, and then baby is pretty much on their way out. With Rebecca's, she hit transition, but hers was 2 hours. However, she would get the strong surge, and then there'd be nothing for about 5 minutes, 10 minutes, and then she would have another one. And then she would get a rest. Like, she actually got a rest period. She also got a rest period when she was pushing. So this is how it is that you don't know how your labor is actually going to go until you actually are in it. And the way that they say in the textbook that you need to have your contractions stronger and closer together, and if they're not, then you're not effectively birthing, it's a lie. It's a lie. It's a lie to set you up to think things aren't progressing. I'm going to be in this for too long, and I'm going to need to have my waters broken to get things going, or I need to get on the birth ball to get things going. I need to do all these exercises to get things going. I need Pitocin to get things going. You see where I'm going with this, right? Like, you're trying to get things going when your body might be like, you know what? Like, we just had a lot of work to do, and now we're going to close up. We're going to just ease off. We're going to stop labor for a bit. You're going to get a bit of a break, and then we'll ramp things back up. Again, this is what happened to me. I had the 24 hours of labor. Things were ramping up, shifting my daughter into a good position because she was probably not in a good position before. None of the spinning babies exercises helped. It was just the fact that, like, when she was finally ready, then she stayed in position. So you can do all those exercises before labor, but it doesn't guarantee that baby's going to stay in that position. Your labor is going to take as long as it takes. And as long as you are feeling comfortable with that, as long as you are out of your fear, as long as you trust the process and you work with your body, you'll probably end up with a really fast end result. So this is what happened to me, is I had a very long start and stop process. And I then was like, you know what? I'm tired. My body has shut down again, and I'm going to sleep. Now, if I'd been in the hospital, they would have been pushing Pitocin, and they would have tried to break my waters. But because I was home, I could send the midwife away. And I said, I'm not calling anybody back until I'm pushing. So then I was able to labor at my own pace, which, oddly enough, even though I was having these intense, strong contractions, I didn't feel them. I didn't feel the pain. It wasn't intense. And I thought that I was in early labor. My entire active labor, I thought I was in early labor because of the fact that I'd go from 7 minutes apart to 5 minutes apart, back to 10 minutes apart. And I didn't have that consistent, close spacing of the contractions. It never happened for me. In fact, just before I hit transition and my waters released, I was ready to get out of the pool and go to bed. Like, that's how it is, though, is that you realize when you look back on your labor, oh, that was transition. Oh, that was active labor. But if you're trying to think which part of it is active labor, which part is early labor, and trying to follow what is in the textbook, it's not going to work for you. And you're just going to start thinking that there's something wrong with you when there really isn't. All right. So the next one, I already talked about this too with the labor traps, is position of the baby. So oftentimes people say, oh, well, baby's in a bad position, so that's why we need to do something. No, 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 no. Your baby is in that position for a reason. Obviously, something within your labor needs to go with your baby in that position, and they will eventually turn. This is even true with breech. So you might have a breech baby. You don't necessarily need to worry about that. You can birth breech. I've seen vaginal breech births. They're awesome. They're one of my favorite things to watch, especially surprise vaginal breech births, because then that's when people are like, wait a minute, this baby was breech the whole time, and this baby was born breech and nothing bad happened. But if that mom had found out earlier that she had a breech baby, then she would have been given all that fear and been possibly pushed into a cesarean. But that's one thing I love, is when people don't know that they're having twins and then they end up giving birth vaginally to twins and it's really easy, or when they don't know that their baby's breech and it's a surprise breech, because then it shows you your body actually does work. And 90% of the time when we interfere, that's what causes the problems. And also, you don't have to worry about following a certain course of action just because your care provider says, hey, your baby's breech, or hey, you're having twins, so now we're going to schedule a C-section, or now we're going to schedule an induction. No, you don't have to do that. You don't actually have to do any of that. So with baby's position, oftentimes people are like, oh, well, the baby is sunny side up, so the baby can't come out. No, babies can still come out. And sometimes they turn at the last minute. So when you are working with your body, you are more likely to be able to get your baby to turn. Now, if you're flat on your back inside of the hospital bed and you've got the monitor and you're hooked up to the IV and you've got an epidural, that's when there's going to be a problem with position, because you can't move out of that position. Or if your doctor insists on having you pushing on your back, well, maybe your baby needs to be upright. Jenny learned this herself, is that she didn't actually know what position her baby was in. But what she did know is that when she tried to get on her hands and knees, it did not work for her. She realized, it's like, I can't get on my hands and knees. Baby wants to be upright. So she ended up birthing while standing up. That wasn't in her plan, but that's what baby needed. For myself, I needed to be on my hands and knees for most of it with my son. And then when I was trying to push him out, of course, they put me on my back. So that caused me to have to push for 3 hours. But instinctively, my body was saying, get on your hands and knees. And that just wasn't a position that they were willing to facilitate in the hospital. If I had known what I now know, and if I had followed what I've taught in Your Empowered Birth, I would have known to advocate for myself and say, hey, I'm actually staying on my hands and knees and you guys can stop touching me and leave me alone. But I didn't know that. All I could say was, leave me alone, leave me alone, leave me alone. And in the hospital, they did not have any concept of leaving people alone. It was the wrong environment to be birthing in, because there is no leaving you alone in that hospital. And then we have labor trap number 5, which is the time in labor. So this is another one that I often see. I was in labor for 36 hours, so I had to have a C-section. I was failing to progress. I was in labor for 72 hours and it was stop and start. And so they ended up running Pitocin and then I had a C-section. Or I was in labor for 12 hours and that was considered long. Sometimes they say that you've been in labor for 12 hours and they need to do something. First of all, it's not true. You don't actually have to do anything just because your labor is long. Now, if you are feeling tired and the contractions are not easing up and you really need that rest, this is a time when you might want to consider having some sort of pain relief or finding some way of dealing with it. This is the time when the epidural can actually be useful, but you want to be able to turn it off after. So it would be like, I need to get some rest. And then when I'm ready, I'll start things up again. Or it can be that you have a very stop and start labor like what I did. So I was technically in labor for about 3 days, but I was in and out of it. And this can happen, is that you can be in and out of labor and you can start your labor and then it fizzles out and then it starts up again and it fizzles out and it gets more intense each time. and then it fizzles out. And maybe you can have a 16-hour break where you need to rest and regenerate, like just relaxing and have some food and be able to just have that time for your body to have a break. Maybe your baby needs a break. So time in labor is not a problem. Just because you have a long labor does not mean that you are not effective at birthing. It means that the system is trying to undermine you and make you think that you are not effective at birthing. So that's all I have for you today. And if you want my book, Your Empowered Birth, you can go and get it off my website, www.empoweringmomsbirth.com/book. And I'll see you next week.